between 5 to 10% of the US population each year has an episode of back pain. What I try to do is put my patients back into control of their lives.
I am thrilled to be here tonight to help us honor Dr. David Bornstein.
And it's certainly a great privilege and honor to recognize David Bornstein with the Marriott Lifetime Achievement Award.
I am inspired by this award to rededicate my efforts to continue that fight against this disabling disease.
He's working hard to understand and improve the lives of all of us so that we can lead our best lives. And I say personally, thank you from the bottom of my heart.
Your pain is your pain, and no one else has your feeling.
I believe that you really need to listen to a patient's problem in order to truly understand what their problem is.
He took all the symptoms that I described to him, and he tried to fix each one.
I was playing basketball. I felt the twinge in my lower back.
Dr. Bornstein's approach gives me confidence.
I can talk to him.
You know, it started as back pain, sort of evolved into nerve pain in my legs.
I was not in a good place. And he listened to me.
What I try to do is put my patients back into control of their lives. The reason why they're so afraid is that they've lost control. They haven't been able to do the daily activities that we all take for granted, like going to work, sitting in a chair, playing ball, playing golf, just a wide variety of things. And because of that fear, they become increasingly concerned that they will not have their lives back. And what I'm able to do is give them back the control of their lives. By listening to their problem, I can give them the pieces of information that they need to know in order to be able to control their pain and actually have a very functional life.
To me, he's a doctor that most everyone would like to have. He's the kind of doctor who wants you to get well. He wants me to be able to do anything I want to do. And at this point, now I can.
I think his attitude towards pain, when I first came there, he said, look, I really believe in minimizing your pain. And I don't, it's not, not going to be 100%, but that's my job, to make you more comfortable. And that's what he's done.
I have run for many years, and when I had episodes of back pain, I was naturally unable to run, in addition to many other things that I had always done.
If it weren't for Dr. Bornstein, I'd be in twice the pain that I am in currently, or even more so. I would be bedridden.
Well, Heal Your Back is sort of a primer for people who really want to understand back troubles. When I finished my stories in telling people how they could get better, they always asked me to write it down. I decided that I would, in fact, write it down, and that's why I decided to write my book on back pain.
Dr. Bornstein's book, Heal Your Back, is especially important to me in that it describes the fact that almost everybody will have some back problem at some time in their life, and that most of it can be handled with common sense.
But I do think the book is able to explain to people what doctors are thinking about, how we figure out what's wrong, and how we actually make people better. And what's important, how individuals, the patient themselves, you, are able to learn what's necessary to actually take care of your problem.